So in this study, the authors examined the role of an anti-IL-17 monoclonal antibody, secukinumab, in patients treated concomitantly with methotrexate in a group of patients who were naive to TNF inhibitors and a small group of patients who were TNF inhibitor experienced. Essentially, the subgroup analysis showed that there was no radiographic progression in the patients treated with secukinumab, whether or not they had been exposed to methotrexate or a TNF inhibitor previously. So the group that was examined in the study who had experienced TNF inhibitors prior to their treatment with secukinumab were a relatively small number of patients, and so the power of the study was not sufficient really to examine differences in terms of response in that group compared to the slightly larger group of patients who were TNF naive. These results are important because while we know that the anti-IL-17 monoclonal secukinumab improves the symptoms and the signs of psoriatic arthritis, this study shows that it inhibits radiographic progression and therefore potentially prevents damage in these patients. And that, of course, preserves function in patients and prevents disability. While this, I think, is an advance on our existing treatments, in particular because the anti-IL-17 does target the enthesial inflammation, possibly more specifically than previous treatments that we've had. It's not a complete answer. We know that some patients do not respond to the anti-IL-17 monoclonal, and so there still is an unmet need in a certain group of patients. And I think the main challenge for us is to identify those patients who will respond to such treatment and those patients who do not respond, and why, in particular, why those patients are not responding.